When performing central posterior to anterior mobilizations, we are going to find the base of the skull and run your finger down until you feel that first bony projection. That would be the spinous process of C2. And we would apply posterior to anterior pressure for about 30 to 90 seconds, performing one mobilization per second. And you would stay on one spinous process while doing so. And then you would move downwards to assess the following spinous processes. And we are assessing for joint mobility and any reproduction of pain or symptoms. And this would specifically be help with ruling up cervicogenic neck pain, so neck pain that presents with headaches. We would feel hypomobile sections in the segments in the neck. And then we would be able to assess specifically for regional interdependence. Help rule in neck pain with radiating pain is an upper limb tension test. And I will have the patient supine. We're gonna abduct the shoulder above 90 degrees. Some say to 100, some say to 110. I'm gonna place my elbow here to help stabilize that shoulder, but not depress it. I'm gonna fully externally rotate and supinate here. Now I'm going to do wrist, finger, and thumb extension. As I go out into extension, we will assess for pain or symptom reproduction. Where did you feel that?
My neck.
Okay. So now we are going to do the same exact thing, but this time we are going to relieve the wrist. And how does that feel in the neck?
Better.
Okay, and so that would help sensitize nerve involvement, indicating it's not a soft tissue or anything else. And we do notice that he's starting to feel that reproduction of symptoms in the neck area. Another test to help rule in neck pain with radiating pain is the distraction test. And so with this one, we are looking to see how the symptoms change. A positive test would indicate that he feels relieved or a decrease in symptoms. So we'll place our hands here on the occiput and cradle the head, not squishing the ears, and then we will gently raise the head and relax. How did your symptoms feel?
Better.
Better?
Yeah.
That would be a positive test, further ruling up neck pain with radiating pain. A final test to help rule up cervical radiating pain is the Sperling's test. And so if the patient was having symptoms down that left arm like he was earlier, we're going to assess the left side. So we're going to extend, side bend, and slightly rotate to the left while I stabilize the shoulder and then apply overpressure to the head. A positive test would be reproduction of symptoms down that left side.